Yes, there's definitely a rush for testing. Last June of 2020, we worked with a vendor, Star Med, who came in and we helped coordinate with them to go to different locations to offer testing. They're still offering testing. They're more independent, working under a state contract. They're at Union Baptist 3 days a week, Monday, Wednesday, and Friday from 11 to 5. They're also on Mondays and Wednesdays at Winston-Salem State. Both events, both places open to the public. But just when you talk to people, and we also know that Novant and Baptist have testing, but there's an issue with finding appointments, also with just the reagents and some of the supplies. And I think that's a concern I have going forward, especially as we wait for more guidance from President Biden about employers of 100 or more requiring either the vaccine or weekly testing. So that's going to drastically increase the demand for testing. We had quite a bit of input from the health department. We met several times with Ben Rao and their planning committee that works year round to put on the fair. Also had several conversations with Ben and Dr. Ohl and I both gave him feedback. So I feel very comfortable, especially when you look at some larger fairs like the state fair that's getting ready to happen. Even Wake County has reached out and asked for some guidance and looking at the plans that are in place. So I feel good. I mean, there's lots of plans for hand sanitizer stations and hand washing, wearing the masks. So I think it's I feel good about it. I really do. Well, I mean, that is, the masking and how they enforce it, that will be up to law enforcement and the fair staff. But I think it goes back, the risk is, I guess the best way to say it, of the fair is, I think the risk is low enough that we can have the fair, but I think it's high enough that we need to be careful and take some precautions. And those are the precautions that you've seen that the city has put in place. So,
and go ahead. I'm sorry.
So, and I think that's a good way really for us to look at all of this. I mean, not just going to the fair, but it could be anything that we're looking at. There is, and I've even heard Dr. Ohl say this, and I would say, we just have to take precautions. And layer those precautions on top of each other. There's no exactly one thing that we have to do, but we still have to live life, but we do need to do things that can be careful. And again, I think you have to take that yourself and look at yourself. I mean, if you are in a very high risk group, immune compromised, then also weigh that in there too. But, if we would take those precautions of trying to keep the distance and the 6 feet apart, wearing the mask, getting the vaccine, taking washing hands properly, taking those precautions, all those layers on top, not one thing is going to make the difference, but taking those precautions, I think that'll keep us safe. I think one thing that we cautioned the fairgrounds about was not necessarily on the midway, but I call them those fun houses or the horror houses. Basically, it looks like a trailer you go up into and you go inside and they're scaring you and, different things like that, where it's inside real close. And it's, we advise that those not be allowed.
Who would end up making that? I was going to say, who would end up making that final decision?
That was the guy
itself.
That's the guidance we gave to the city to give to I think it's straight shows.
Right.